And then we also, with that same grant, we're trying to educate seniors about the preventive services that are available to them through Medicare. There's a lot of preventive services that they can get, mammograms, colonoscopies, and things like that are covered at 100%. So we want to make sure that people understand that those benefits are there as well.
Welcome to For the Health of It, Because You Can, where host Susan Robinson dives into the 8 categories of wellness with experts from various fields. We offer tips and information to help you thrive in all areas of individual wellness.
Okay, so I've been visiting today with Ray Walker, who is with the Oklahoma Insurance Department. And we're going to talk about a lot of things that you may not be aware of that is available to you as employees, but also if you have parents that are aging. And I think this is going to be very beneficial for you to learn about. So I looked under the consumer assistance information on the Oklahoma Insurance Department website and found Medicare Assistance Program. I was discussing with Ray that more people are working past the age of 65. And I know I was misinformed whenever I turned 65 about when to apply for Medicare and that I was supposed to, even though I found out you're not. So we're going to delve into some misconceptions, but then also what is available for you to get educated on. Education is power, everybody, let me tell you. So the more you learn, the more that it's going to benefit you. So, Ray, why don't you tell me about the Medicare Assistance Program, or the MAP is what you called it, right?
That is correct. The Medicare Assistance Program is a division of the Oklahoma Insurance Department that is actually funded by federal grants. The Oklahoma Insurance Department sought out and applied for these grants, received them, and each one of these grants gives us funds to go out and provide different services to seniors across the state. One of them, the Senior Health Information Assistance Program grant, provides us with funding to educate seniors about Medicare. What is Medicare? How does it work? What are the different parts of Medicare? What are your options related to Medicare? And what do you do if you've got a problem with your Medicare? If you're having an issue or something, we can assist with that as well. Then our second grant is the Senior Medicare Patrol, or the SMP grant. That's the one that gives us funding to go out and educate seniors about how to protect themselves from becoming a victim of fraud, waste, and abuse in the Medicare system. Then our third grant is the MIPA grant, which that one we're trying to find low-income seniors who are having trouble affording their prescription medications. And with that one, we get these people signed. If they meet the income and asset limits, we get them signed up for this program that will pay their monthly premium for their Part D drug plan, and it also lowers their copays for their prescription medications. And then we also, with that same grant, we're trying to educate seniors about the preventive services that are available to them through Medicare. There's a lot of preventive services that they can get, mammograms, colonoscopies, and things like that are covered at 100%. So we want to make sure that people understand that those benefits are there as well.
Right. It's just there, but nobody seems to know to go
that
there
is
and
correct.
Find that out. So I was also looking at what you guys offered, and there's a couple things I wanted to talk about. One of them is Medicare Mondays, what that's about, and then also Medicare 101, which that sounds more like an education. I guess they're all education, but that one in particular goes into a little bit more different direction.
That is correct. You know, we were talking earlier about the impact the pandemic has had on how we do education. So we were certainly put in a position where we relied more heavily on web-based opportunities to educate seniors. So we started the Medicare Mondays, which is a short, it's a 30-minute webinar that is typically about one topic. For instance, the one coming up in April is about the Part D drug plans and the Part D, the cycle of the Part D coverage through the Medicare system. And we will we'll have that one topic. We do allow questions to be typed in, and that's the first Monday of every month. Then we have Medicare 101, which is a much broader scope. That's actually a live event that we currently are having at our office here in Oklahoma City. We're going to have to be looking for a new location temporarily while we have some renovations done to the building, but for now it's still there. And at that one, we're trying to answer people's questions. People come in with, what do I do about my drug plan? Or I don't understand why I can't get a Medicare supplement, or things like that. And so it's much less structured and very much aimed at getting people the specific answers that they're looking for.
Right, and this could be people at any stage in their life, either thinking about Medicare or you were explaining that earlier.
Yeah, well, and as well as you pointed out earlier, it's for caregivers too.
Right.
You know, a lot of times the people that are needing to learn this information aren't necessarily the Medicare beneficiaries themselves. They're those people that are aiming to help a loved one, a family member, or someone like that might be in need of assistance. Not all Medicare beneficiaries are 65 or over. It's possible for a person to be on Medicare under the age of 65 if they've been on disability for 24 months.
Oh, I didn't know that.
Yeah, so sometimes the people that we're working with are much younger and helping them understand. The same thing is true if a person is diagnosed end-stage renal disease. They also qualify for Medicare under specific circumstances. So helping people understand the pros, the cons, when is the right time to enroll, as we were talking about before, it's very, very different.
So in the two programs, when do they meet, actually?
The Medicare Mondays is the first Monday of the month, and you can actually go on our website at map.oid.ok.gov, and there's a place where you can register for Medicare Mondays, and you'll get sent a link where you can call into that program. It is at 10 a.m. on that first Monday of the month. And then the Medicare 101 is at 2 p.m. on the third Monday of the month.
Okay. Well, that sounds good. And you guys, this is really valuable information, especially if you have aging parents or if you're aging yourself, still working. That's okay. So I also saw two divisions of the MAP, or the Medicare Senior one, and you talked about counseling and the Senior Medicare Patrol. But I also saw that you help people when it's like you get every year, because I hear my brother who's retired talk about it, that there could be changes in Medicare. Like, how do you know if there's changes? And is that the kind of things that you cover?
It is.
As far as, because, what if you don't know? And
Absolutely.
Yeah.
We've got some changes that are coming about. We're in the middle of some of the changes right now with the Inflation Reduction Act that's had a big impact on prescription drug coverage. One of the changes last year, 2023, it capped insulin costs at $35 a month for people who needed insulin. It also took away the cost sharing for the vaccines that are covered by Part D, such as the shingles vaccine. Then this year, there's some other changes that are taking place as a result of the Inflation Reduction Act. It took away the 5% that a person has to pay in the catastrophic phase of the Part D coverage, which we don't have time to get into right now. And then everyone's been hearing for a while now that CMS is going to start negotiating drug prices for those very high drug costs. So that will actually take effect in 2026. So there's a lot of really great changes that are taking place. And one of the things we try to do is make sure that people are aware of those changes and how it impacts them. Some of the changes don't take place at the CMS level. Some of the improvements take place right here at the state level. At the Oklahoma Insurance Department, the commissioner, they implemented what is called the birthday rule that took place this year. And with that rule, for people who are on a Medicare supplement plan, those individuals, as we were talking about earlier, once they're on a MedSup, if they've got an illness that they've developed, it's hard for them to change to a different plan because the plan they may be looking at could apply underwriting, and they may say, no, we're not, you're too high of a risk. Now, as a result of this birthday rule that was just implemented, a person who is currently on a Medicare supplement plan has a 60-day period that starts on their birthday every year, during which they can shop around and get another Medicare supplement plan, and they have those guarantee issue rights. They cannot be denied or charged more for a Medicare supplement policy. So we try to get the word out as much as we can about all these changes.
You were also talking earlier when we were visiting outside about if your parent lived in another state.
Mm-hmm.
So tell us about what somebody would need to do if they were moving their parent from one state to another.
Yes. The one thing to keep in mind is our program, the SHIP, the S&P program MAP, there's a program like ours in every state. So for one thing, if you've got a loved one that is in another state, encourage them to find the program like ours in their state. It's either going to be in the insurance department, like ours is, or it could be in the Department of Human Services. So it depends on what state that they're in. Secondly, if you've got a loved one that is moving to your state where you're located so that they can be closer to you, that's going to make some changes with their insurance potentially. Now, if they're on a Medicare supplement plan, no big changes necessarily. Medicare supplement plans are good anywhere that Medicare is accepted in the United States. However, if your loved one's on a Medicare Advantage plan, that could mean big changes for them because now they're moving out of the service area for their Medicare Advantage plan. So we're going to want to look at as quickly as possible what is their current coverage, what changes might need to be made so that they're getting the care that they need. Hopefully, if they've got some condition or something that they're being treated for in that state, maybe that doctor's been able to refer them to a specialist here that's going to be able to so there's no breakdown in the continuity of care. But we also want to make sure there's no breakdown in the continuity of insurance.
Okay. Well, that makes sense. So lastly, I wanted to talk to you. I read on there, what is a MAP volunteer?
Okay. Well, am I glad you brought that up? These programs, these grant programs were founded on the concept of utilizing volunteers, particularly seniors, people who themselves are in these positions, who are still perfectly capable of providing the assistance that we do to the individuals in their community. And we utilize volunteers to do a number of things. The events that take place around the state, whether that's Senior Day at the State Fair or an event at a church or something like that. Our volunteers will man the booth there. They can also do counseling. They can assist with materials if we're distributing materials to churches or things like that. So anyone who has an interest in possibly volunteering for this program, we encourage them, please get in touch with us. Now, we are very strict about our volunteers. Our volunteers do have to go through a background check because, after all, one of the things that we focus on is Medicare fraud, and we certainly don't want a fox in the hen house. So, but, it's a great program. We love our volunteers, and we'd love to add more to it. Right.
Well, and, the state has retirees, and I try to keep retirees looped in. In fact, on Thrive's website, we have a tab that is 50 plus. And so we have plenty of employees that are, that age or above or for their parents. And so we really want to make sure that they are informed. I can't believe what all you're offering. In fact, I would probably start to come in to listen to some of these things and attend. And so Ray Walker is a wealth of information from the Oklahoma Insurance Department. And I will tell you, we will also have on there how to get in touch with them. And so, but I also noticed on the website, which Ray's not specifically about this, but I also noticed that they have information on ways to lower your auto and home insurance. They have consumer knowledge base. They also have severe weather readiness, which we're about to go right into. And I think we're going to have a rough spring this year for sure.
I think you're right.
So I really appreciate you coming in and informing us on this. And like I said, please take advantage of what the insurance department and Ray Walker has to offer. So you guys have a great day, and we'll see you next time.
Thank you for listening to For the Health of It. For more wellness tips, information, and videos, visit the Thrive webpage. For questions, contact us at thrive@omes.ok.gov.